Hello, everyone, and welcome back to my CRPS Q&A series. This is Q&A number 8. It has been a little while since I've been here with a Q&A, but I am back and excited to bring this to you. After Q&A number 7, I was so excited about the popularity of that live Q&A and how much so many of you found it to be helpful that I wanted to make sure Q&A number 8 was just as good, if not better, than that live version. So I took a lot of time collecting questions. I believe on my post on the Facebook group, we had about 82 comments of questions or discussion around CRPS, which I really love to see because these videos are part of my continued effort to get good and solid information out there when it comes to CRPS. So if you are confused, if you're recently diagnosed and you were looking for advice and answers, you've come to the right video. Give me an hour or so of your time, and I promise you will leave here feeling a lot better than you did previously. If you don't know who I am, my name is Chase Teagarden. I am not only a doctor of physical therapy, therapeutic pain specialist, and fellow in pain science who has received extensive training on treating CRPS, amplified musculoskeletal pain syndrome, fibromyalgia, and many other complex pain conditions. But I was diagnosed with CRPS myself 10 years ago, and after a 4-year journey, I am now pain-free and treating people all over the world with complex pain conditions in places like Australia, Switzerland, Ireland, South Africa, Canada, and the US, just to name a few. If you would like more of my resources, you can go to my website, thewindowpain.com. You can also find my 8-week self-guided online program that has an entire decade of my knowledge in one place for you, accessible at any time. Or you can reach out to me for one-on-one pain coaching if you would like to have a testimony like some of these people here and break free from your pain for good. All of those links can be found in the description down below. Without further ado, I've got my coffee, I've got your questions, and I'm excited to get started. Typically, I go through these questions in order that they were asked, but in an effort to make this Q&A more cohesive, I'm going to start out with one question that I think is very good, a solid question that I think will kind of shape up the entire video for us as a whole and give you the background that you need to understand my answers to the questions that follow. Okay, so that question is from Brenda, and Brenda says, if it is full body and affects my internal organs, can it be reversed? And what I say to Brenda is great question. Yes, it can, and I'll explain why in this video. So what I'm going to do is I'm going to grab a whiteboard. I'm going to do a little bit of a presentation that I call re-explaining pain, and that's going to set up the basis for the rest of this video so that you can understand my answers when it comes to a heightened, a overly fight or flight or centrally sensitized nervous system and what I mean when I refer to that. So without further ado, let's start the presentation. Okay, so I'm going to use this whiteboard to help me do this presentation. This presentation is called Reframe Pain. So let me write that up here. Okay, and the reason reframing pain is important is because for a long time there was a significant misunderstanding of pain in the scientific community. And now, as of July 16th of 2020, the International Association of Pain put out a revised definition of pain, as we've mentioned in a couple of our other modules. And that is a sensory or emotional experience that is influenced by actual or potential slash perceived tissue damage. So with that definition, which we'll put up here, a sensory and emotional experience we learn that pain is complex and it involves many factors. And those many factors are the things that lead us to a situation called central sensitization. And that is what's happening with CRPS. That's also what is happening with a lot of other chronic pain conditions. So I'm going to go ahead and break that down for you here. First thing we need to know is in that definition, when it mentions actual or perceived tissue damage, what that is actually saying is pain is not equal to damage. Okay, so we can have pain. We can have pain and we can also have no damage at all. So this is true in CRPS because we do all these scans and we check everything, the tissues, etc., and you see no damage, but you're having pain. The pain is very real. It hurts horridly, right? Some people can't even wear a sock. Sometimes even the wind touching hurts, but there's no damage involved, but there is pain. Another example of this is something like a paper cut. Paper cuts are very small, but it has a ton of pain. Okay. And I don't know if you've ever experienced this, but you can also have damage and no pain. Okay. So a way that this can happen is if you cut yourself out in the yard, and then later you look and you say, oh my goodness, I cut my arm. And you didn't even know about it until, hours later after working in the yard or working in the garage, etc. And then sometimes when you look at it and you see it, then you have pain. Okay, so those are some examples of pain without damage at all. Okay, now I'm going to draw a graph here to illustrate this process a little bit. So in our body, we have a resting electrical activity level, and that level is going to be marked by this. This is in a normal bodily system. This is where our level is. So the blue line is the level of activity in our nervous system, and that's the resting line. Now, we also have a threshold of activity, an activity threshold, that is going to be characterized by this red marker. Okay, so this red line is a activity threshold where if our activity goes above that threshold, we might experience pain. Okay, so that's a might have pain threshold. Let's call it that. So we'll put a pain question mark threshold. Okay, that's what we'll call that. Now, let's say you don't have CRPS or in an area of your body that's not affected by your CRPS. I was to kick you. Okay, so let's say, if you don't have pain in your elbow or your earlobe, let's say I kicked you in that area. Two things are going to happen. First, there's going to be a lot of paperwork. I'm going to get in trouble, right? The second thing that's going to happen is there's going to be, well, here's the kick marked in red. Okay, the kick happens there. Then, I'm going to see, there's a little glare there, but you can see it. So the kick happens there on the red X. Then there's going to be a spike in that activity threshold. And this spike is going to send our electrical activity in our nervous system up above that line. Okay. Now, we used to think that this spike represented a pain signal being sent. So a kick from the in the elbow sends a signal up to the brain, and the brain feels it, and then there's pain. That's not actually what's happening. What's happening is that you get kicked in the elbow or the earlobe, signal goes to the brain, and the brain decides if pain is useful. So an example of this I've used before: step off a curb and sprain your ankle, it hurts. Step off a curb and sprain your ankle, and there's a bus coming at you, doesn't hurt. And that's because the brain decided pain is not useful right now. We need you to heal or get out of the way of the bus so you don't die. Okay. So electrical signal sent up to the brain, simultaneous spike in activity going up above the maybe pain line. This signal is a danger signal, so not a pain signal. There's a danger signal sent up there. And then after you get away from me, the person who kicked you, and your elbow or your earlobe heals, what should happen in a normal system is that spike should correct. It should come back down. So this is what would happen. Come back down like this. Being down here on either side is the place where someone who isn't centrally sensitized rests on a daily basis. And being down at this activity level allows us to have a lot of space for activities. So those activities are things like groceries, dancing, laundry, activities that you do normally day to day. and you would never have pain, okay? Because while you're doing those activities, yes, gradually you're having little spikes in activity going up, but then that spike corrects and comes back down. So in this space here, where you have a lot of room for activities, you're looking at groceries, exercise, work, family stuff, hobbies, etc. All in this space, you're able to do all those things without pain because your system is not sensitized. Now, what has happened, whether it was from an injury initially or not. So some people with type 2 CRPS had an injury to the nerve or an injury of some sort. And then some people with type 1 didn't have any injury at all. It just suddenly came on or slowly came on. What has happened is your nervous system has become sensitized. And so instead of going back down like this one does, what has actually happened is it has stayed up, and I'll show you what I mean. So instead of coming back down after the kick, it has stayed up here. And since it has stayed up there, we are always really close to that maybe pain threshold. And for some of us who are feeling this CRPS pain very severely, you're not even close to it. You're just always over it. Okay, so sometimes you live above it. And what has happened is any activity that we do, it's sending a danger signal to the brain, and it's telling the brain, maybe I need pain right now. And so the brain is reacting to that and causing pain. And so that's why, because you're operating here, you only have this much room for activity. And that means that not only are you in pain, but you're continually fatigued. You're having trouble concentrating because your nervous system is what we are calling, of course, sensitized. So I'm going to write that right here. This situation is called sensitization. Okay, central sensitization. So I'll put a C here to represent central. So we've become centrally sensitized. And this happened through a process that is known as neuro neuroplasticity. Okay, that is the brain's ability to change. Not only the brain, but our entire nervous system. Okay, so the nerves in our body, our spinal cord, and our brain. That is what the central nervous system is, and that is what central sensitization refers to. Sensitization of the central nervous system. Okay, so because of this, because that it was neuroplasticity that got us here, that also means that we can reverse it. Neuroplasticity works in both ways. Okay, so when we learn piano, our brain has neuroplasticity, adapts and makes it easier for us to play piano. If we stop playing piano later in life, our brain adapts again and we forget and we can't play piano as smoothly. Okay. It's the same thing with things like riding a bike. First, we don't know how to ride a bike. Then we learn. If we don't for a while, it might be kind of hard when we get back on it. But neuroplasticity works in both ways. So I'm going to draw that. Neuroplasticity can work for us or against us, okay? And now, what are the things that got us here to this point, and how do we reverse it? That's probably what you're thinking. You're probably thinking, Chase, yes, I know I'm here. It's horrible. How do I get out of it? Well, and also, how did I get here? So let's go through that. Let's talk about it, okay? I'm gonna do some bullet points here. Okay, so these are going to represent the things that got us here, and then also the way we're going to get out of it. Okay, there are several factors that contribute to this, both peripheral factors, which means outside of our brain and spinal cord, outside of our central nervous system, and then central factors, which means inside our central nervous system. So let's look at the peripheral factors first. Okay, so these are the peripheral factors. The first one is injury. An injury of some sort could make us more sensitive, could make us centrally sensitized. Okay, so initially, an injury of some sort could put us in this situation. Like if you sprain your ankle, have a surgery, etc., it could do that. So that's one. Injuries, however, will only be a contributing factor for about 4 to 16 weeks, okay? Unless we have another surgery or sustain another injury, they are only a factor for 4 to 16 weeks. And the reason is because all injuries heal in roughly 4 to 16 weeks, all tissue type injuries, okay? So even bones will heal. So if you are outside of this injury window, then that doesn't necessarily pertain to you, okay? The next one that could be a factor is movement and positioning, okay? So, so if we don't move for a long time, or we hold our arm like this, or for me, when I had it in my foot, I would hold the walker and I would hold my foot up like this as I went around. If we hold our body in a certain position for a long period of time, whether we have CRPS or not, and we stay, lying in bed or on the couch, or we hold our hand, like this, or our foot up like this, like I did, that will sensitize us more. Okay. If we move in a controlled and safe way, in a comfortable way, that will actually start to desensitize us. Okay. So it's working in both ways in the same way that injury can. Okay. So that's another factor. The next possible factor is something called structures. Why am I whispering? I am whispering because structures, as we will talk about in another module later in this course, structures really have very little to do with pain. I don't know if you know this, but meniscal tears, rotator cuff tears, um, what else? Labral tears, bulging, herniated, degenerative discs, etc. Those often get blamed for sensitizing our nervous system, and they might play the smallest role, but a lot of those changes actually occur in people who are completely healthy and have no pain whatsoever. So there was a study, which we'll talk about again in another module, but there was a study that took 3,110 individuals from the ages of 10 10 to 80 years old, and they scanned their backs for degenerative disc disease, bulging or herniated discs, spondylosis, spondylitis, spondylolisthesis, stenosis, all of those back changes, right? And what they noticed is that from 10 years old to 80 years old, the prevalence of these changes in their back looked something like this. So as people age, those changes increase, okay, in a linear fashion. By the time people reach 80 years old, 96% of people will have some or all of those changes in their spine. 96%. So what that tells us, and one more thing about this study, the 3,110 people involved in this study, the requirement for them to be in the study is they had to have no history of back pain whatsoever. Okay, so this is in people with no pain at all. What that means for us is that these structures have very little to do with our pain experience. And I am someone who thought that my herniated disc had everything to do with my pain. I even had 2 surgeries. But research shows that structures are a very small and mostly insignificant part of the pain experience. So sometimes structures can play a role in sensitizing us, but hopefully learning that information has helped desensitize you and your worry about structures just a little bit. Okay. If these things are going up in a linear fashion as we age, you know what else goes up in a linear fashion as we age? wrinkles in our forehead. And these wrinkles in my forehead, which are an aging change, I'm getting older, um, these wrinkles in my forehead don't cause my headaches. Okay. My hairline doesn't cause my headaches either. Okay. So what these things that are happening in our backs or our shoulders or our knees is likely more just a result of us aging, a natural process by our body, and not necessarily something causing pain. So I want you to know that. I'm going to reposition here so I can better fill out our central factors for us. So give me a moment. I won't cut this if it's smooth enough. Oh, that's pretty smooth. We'll leave it in. Okay, so now we're on the side for central factors, okay? And don't worry, at the end of this, I'm gonna take a picture and I'll put it on there so you guys can actually like pause this and look at this in more detail as well. So here we go. Central factors. So, from a central factor standpoint, which is in our central nervous system, okay, so this is a systemic thing. Remember, we're talking about central nervous system sensitization, okay? Another thing that contribute to us becoming more sensitized or less sensitized are medical factors, okay? And what's included in that? Messaging we've heard from medical providers, medical procedures that we've had, medications that we take, either for CRPS or other conditions. All of those things can contribute to sensitizing our system or desensitizing it. Okay, so I'll write that up there, medical factors. Okay, so medical factors could include something like gabapentin. Some of you have taken gabapentin and found it helpful, and that would be desensitizing the nervous system. Some of you have taken gabapentin and found it awful, like myself, and that has sensitized your nervous system. Okay. Some of you may have diabetes. If you don't get your check your blood sugar and make sure it's maintained, you probably feel pretty awful. That is sensitizing us. Okay. Other medications or things that doctors say, like pointing to structures as the problem, that because of the fear and anxiety, remember where that's processed in our brain, same place as pain, the amygdala, that will sensitize our system. Unless we learn what I just told you, then we won't freak out about structures. Okay. So medical factors are a big component. The next category is lifestyle factors. So lifestyle factors are things like diet, exercise, and sleep. If I go to In-N-Out, so I don't, some of you are in the UK or Australia or Canada. I don't know if you guys got In-N-Out, but it's a burger place here in Texas, from California originally, but it's a burger place. If I go to In-N-Out and I eat In-N-Out for a week in a row, and I drink the milkshakes and eat the fries and be an American, right? After that, I'm going to feel pretty awful, aren't I? But if I fill my body with things that I find nutritious and feel healthy to me, I probably won't feel as bad. So In-N-Out for a week, sensitizing. No, no In-N-Out, health smoothie, desensitizing. Okay, so that's going to help with our pain levels as well. Sleep. Sleeping is really hard with pain. And actually, what I'm going to do is I'm going to attach in this lesson, in this module, my sleep toolkit. Okay, that's an 11 item list for things to help you improve your sleep. I will attach that there to help you calm the mind and get ready for sleep. Okay. Additionally, I'll include a attachment as well that has a free application called Insight Timer, and it has thousands of meditations to help us calm ourselves throughout the day and get ready for bed as well. So look for that in the attachments at the end of this lesson. So diet and sleep are two main factors, and then also exercise. Believe it or not, exercise releases natural painkillers, serotonin and dopamine, to assist with desensitizing our system. Now, with respect to the fact that you're in pain, exercising might be hard. So we're going to have to explore in the next module some ways we might be able to achieve that without putting ourselves into a flare, okay, and slowly getting back to exercise. We have to start moving towards that, give the brain information. Otherwise, we'll never be able to do it, okay? So exercise is a part that can be good, but we're going to have to look at strategies to do that. So lifestyle factors include, I'm going to write them here so you have them. Diet, sleep, and exercise. And then the medical factors, I'll go back up and add there. Medication and information. So medication and information are a big part of our medical factors too, as I mentioned. Now, this last category, I'm actually going to write in red, and I'm going to write it in red because I believe it's one of the most important categories, okay? So, this last category that can sensitize our nervous system is personal personal factors, and I underline it twice and circle it. And the reason I do that is because all of you have had the experience of something personal going on in your life at one time or another that has led to your body feeling horrible. Okay, sensitizing our nervous system. So, some things that can make our body feel horrible is a heartbreak, losing a loved one, we could also be going through, a divorce, a legal battle, a job change, a job conflict, a personal conflict with friends, um, family turmoil, etc. All of that is going to make everybody tense. There's going to be a lot of tension, and that is going to sensitize the bejesus out of our nervous system, okay? So that's another thing that can centrally sensitize us. But if we can work towards resolving that or separating ourselves from that situation or setting boundaries, we can start to desensitize our nervous system. Okay. So, as you can see, there are a bunch of different factors here that play a role. We have injury, which is irrelevant after 4 to 16 weeks. We have movement and positioning, which we can do. We can move and reposition and keep ourselves as mobile as possible. We have structures, which is so-so. We have medical factors, which are things doctors have said to us that we need to unlearn or learn proper things, correct? And also medications. We need to find our medication balance. Medications, it should be for CRPS, should be a bridge, not a road. Okay, so these don't need to be things that are lifelong. What we should do is we should use them as a bridge to get us through the initial pain. And then as we can, as the pain gets better and improves, we can work with our medical provider to wean down the medications. I myself was on 16 different medications, opioids, sleeping aids, nervous system depressants like gabapentin and Lyrica. What else? Antidepressants, muscle relaxers, etc. You name it, I tried it. When I stopped taking the medication, I did it improperly. And so, what I would recommend is that you slowly wean down, if that's your goal, to get medication free with the supervision of your medical provider. That will help us control this sensitization and then slowly desensitize again. Okay. And then the last thing, personal factors. In another module, we're going to cover how to address that, how to start feeling our emotions again so that we can feel our emotions properly instead of feeling them in our body. Okay. So this has been Reframing Pain, the presentation on it. I'm going to go ahead and put a screenshot of this board right here, and I'll leave it up right now for about the next 10 seconds. And I want you to go ahead and take a snap of this. And I'll also, you know what I'll do to make it easy for you? I'll go ahead and put that in the attachments for this module as well. Okay, so I want you to go ahead and soak this in, rewatch this video if you need to absorb this presentation again. And then I want you to start to consider for next week, go ahead and write down, consider for yourself what of these factors are playing a role in your central sensitization? And how can you start to address each one individually to start to desensitize yourself? You might not be able to take care of everything at once, but there's certainly a way that we could start to improve our diet or address our sleep, start things like meditation from the app that I'm going to give you, etc., and start to improve these things little by little. Okay. All right. So I hope you found that presentation helpful. I think it does a great job at explaining, what it means to have a centrally sensitized nervous system, aka a nervous system stuck in fight or flight. I also think that that presentation is the perfect start to this video because it's going to set us up with some base knowledge to enter into answering these other questions. Okay. If you are in my online 8-week program, you might have recognized that presentation. It is a version of the presentation that is in my program in Module 3. If you are not in the program and you found that presentation helpful, I just want you to know that that presentation is a small snippet of the mini lecture videos that I have on CRPS in that program. Remember, that 8-week program is 10 years of my knowledge condensed into one step-by-step process to help you overcome and return to life despite this CRPS diagnosis. So if you are interested in learning more about that, you can go down to the description down below. There is a link to the program, and that includes a coupon code for that program as well for you to use at any time. I would love to have you. We're at about 153 students last I checked, and counting by the day. So thank you to all of you that are in it. I hope you enjoyed that little presentation there, and let's jump into the next question. So the next question I have queued up is from Holly, and Holly said, I try not to get on the groups as much, and I stay offline more often also. When I was on the support groups more, I heard something about a dental protocol recently, and I had dental work done, and it had me slightly debilitated for a couple days afterwards. Do you have any thoughts on CRPS dental protocols? Yes, Holly, great question. So, my general thoughts on a CRPS dental protocol is that there is no universally accepted or evidence-based protocol for CRPS. Can you find dental protocols on websites? Yes, you can. But I find that those protocols often lead to a higher sense of catastrophization about what is happening with your body when it comes to CRPS, and sometimes do more harm than good. So, in general, there is something called the nocebo effect, and that effect shows that fear something, if we fear something will make something worse, if we fear that an outcome is going to be negative, oftentimes it is simply because we fear it. Okay. And when that's the case, if we have this hyperfixation on control or on protecting ourselves when it comes to these routine dental visits, that might make our nervous system more hyperactive than it needs to be when it comes to some kind of general procedure. Now, can dental procedures trigger flares in some people with CRPS? Yes. In cases where there has been trauma to the jaw or face, if you have like trigeminal neuralgia or something like that, then yes, of course, you want to be a little bit careful when you go into a dental procedure. If you are under a whole bunch of stress just in general, or you get very stressed going to the dentist, then yes, of course, you want to be careful. Additionally, one thing that may be something to note is that anesthetics that include epinephrine can sometimes overstimulate the sympathetic nervous system. So maybe asking the dentist to use an anesthetic that does not have epinephrine would be a good thing to do. But most people with CRPS will have dental work done and they will have no flare at all, especially when they have calmed their nervous system down and retrain themselves to not have as much fear associated with going to the dentist. So, in summary, CRPS dental protocols are bad in that they sometimes suggest things like delaying dental work indefinitely, using only certain brands of numbing agents, demanding extensive sedation for really simple procedures, taking weeks off of work or life to recover from a cleaning, or preemptively medicating for minor dental work. This is bad because it leads to increased catastrophic thinking, which can increase pain. It leads to increased avoidance of medical procedures, and it reinforces a belief that our bodies are fragile. The body is very resilient. It can overcome a lot of things, and that includes CRPS. And so honing in tightly to a dental protocol or a bunch of protocols that are posted on nonprofit websites, for example, or non-research back sources could be dangerous. I think a better approach to dental visits is find a dentist that's familiar with chronic pain patients, ask them to take things slowly, maybe suggest anesthetic without epinephrine, self-regulate before going into the dental visit, do some breathing techniques, vagus nerve stimulation, etc. And, if you're feeling sensitive, explain to your dentist that you would like them to go at a bit of a slower pace. And I think that will work well for you. Overall, I think protocols or control mechanisms and things like that might do more harm than good. So I would just take them with a grain of salt. There's some good suggestions in there, but there's some that are fear-inducing. And as you know from the psychological cycle of CRPS that I've mentioned a few times, I'll put that on screen here. The more that we can move away from the catastrophization of what's happening and more into a situation where we're confronting our fears and moving towards function, the better. So having protocols or things like that in place can sometimes do more harm than good. And Holly, I'm going to call you out here because I know you can handle it, but you mentioned that you try not to get on the groups and you've been staying offline more. I don't know if you know this, but I can go into the groups, the RSD groups, or some of these larger groups, not the window pane group that we're in, and I can search your name. And in the last month, based on my search, you've commented about 45 times or more on posts in these groups. So maybe that's cutting back, but I just want to point that out to you because sometimes being in these groups where you see a lot of scary pictures, you see a lot of people feeling the doom and gloom, that might be harmful to your mental health overall. So scaling back or at least being careful about what you're absorbing in there might be good. And that feeling that you had of feeling debilitated for a couple days after your dental work might have been because you were reading about these dental horror stories when it comes to CRPS. So just something I want to point out, not to call you out at all, but I think we should keep ourselves honest. There's a lot of clients of mine that say they've gotten out of the groups or they're not commenting on them as much, but upon further investigation, I've noticed that you are. So be careful there. The groups are really great to feel supported, feel like you're not alone, but it's a fine line when it comes to our mental and cognitive understanding about what's happening to our body. Okay. Excellent. Okay, Donna, I've had insomnia really bad since CRPS. I can't handle prescription pills to help me sleep. Any recommendations? Yeah, Donna, great question. I've answered this a few times in some of my other Q&As, but I always love repeats for repetition. What I would suggest for things to help you sleep is anything that helps you feel calm. So for me, it's something like a chamomile or sleepy time tea. Sometimes those teas have melatonin in them, magnesium, L-theanine. Any of those kinds of things can be really great for sleep. I'll put a few pictures on the screen of some of those that I use in particular. And that's just good to help you wind down for sleep in general. Having a sleep routine, like for example, taking a hot shower, drinking the tea, doing a meditation on the Insight Timer meditation app. This is a sleep meditation that I particularly like, so you could use that one. That can be really helpful. So that's something to try. And then lastly, if you're not on it yet, I have an email newsletter where I often send out tips and advice about CRPS. And my sleep toolkit newsletter is a very good one. I think I have 10 or 11 suggestions on there on ways to improve your sleep, including some of the ones I just mentioned. So if you want that newsletter, or to sign up for that newsletter to get that toolkit, please go down to the description down below and you can find a sign up link there. If I'm able to, I'll put a download for the toolkit down there as well. So those would be my recommendations. Donna, great question. Thank you. Let's see. Who do we have next? Denise, my question is CRPS pain and hypersensitivity is getting better since I started Chase Teagarden's online program and started PT again with a different PT. However, it seems like this is not helping with the swelling of my leg. Is there something I can do to help with swelling/inflammation? And then Virginia said, I wonder if Chase Teagarden would advocate for a tapering dose of oral steroids. So oral steroids can be helpful with swelling potentially, but they wouldn't be my first line of action. I think a tapering dose of oral steroids is fine if you have significant inflammation. But if you have repeated swelling, then I don't think they would be like the first thing I would try or go with, Virginia, in that case. Denise, when it comes to swelling, well, firstly, I'm very excited that you're having and seeing improvement in my online program. In module 4 of the program, I talk about ways to help with swelling. These things include regular movement, because remember in some of my other videos, I mentioned the valves in our veins. Those valves, whenever our muscles contract in our leg, are going to open like this and push fluid from swelling up the leg. Okay, so that's one thing. And then, ankle pumping, those kinds of things. Additionally, what you can do to help with swelling is wearing something like temporary compression garments or working with a certified lymphedema therapist, a CLT. I'm actually a CLT myself. They can be physical therapists, or even better, sometimes are massage therapists that are CLTs because they just are hands-on the body a bit more. And you can also look into lymphatic taping. Okay, so or taping for edema. That is another thing that you can look into, and I'll put a picture on the screen of what that taping looks like here. A lot of PTs can do this. The CLT certified ones for sure, and then CLT certified massage therapists can do this for sure as well. So just search certified lymphedema therapist in your area, and you can probably find someone. And even if your PT isn't a CLT, they probably know some taping for inflammation too that will work just fine. Okay. So yeah, check that out. I am not saying you have lymphedema or anything like that. That's the title of the certification. Okay. So don't worry about that. That's not the case. These types of therapists know how to help with swelling pretty well. Okay. All right. Madeline, hi Chase. Is too much exercise a bad thing for CRPS? Also, is there a correlation between Epstein-Barr virus and CRPS? Thank you. So great question, Madeline. As you noticed in that presentation, when we are centrally sensitized, we have only a little bit of room for exercise and daily activities. And so sometimes when we do a lot of exercise, we'll spike ourselves up over that threshold to where we might experience pain. This doesn't always mean that we're going to experience pain, but that is a possibility. I think that exercising is really good for CRPS. I think that as long as you are not extra sore or in pain for longer than 48 hours, you are in the safe zone for CRPS. So if you feel some soreness, if you feel some pain, that is normal, especially if it lasts under 48 hours. Jenny commented, yes, too much exercise can aggravate it. It can aggravate it in the sense that you can feel a bit of a pain spike, but it's not going to aggravate it in the sense that that's going to be your baseline pain forever. Okay. So I don't want you to read that and get nervous about exercising. We have to exercise and move towards function again. And yes, it might cause an initial pain flare, but flares are called flares for a reason. Flares eventually burn out. Okay. So please do not fear exercise. Please go try and be functional. That is important. Okay. Now, is there a correlation between Epstein-Barr virus and CRPS? From what have seen in the research, there is no solid evidence linking Epstein-Barr virus to CRPS, but Epstein-Barr virus may play a role in the broader immune dysregulation seen in some chronic conditions. Okay, so it doesn't really matter if there's a correlation or not. The plan is still going to be the same. We're going to exercise ourselves or move towards function. We're going to move back towards the things in our life that we find meaningful and that bring us joy. And we're going to follow that same protocol that I mentioned in the central desensitization that we are working on to move towards remission/recovery from CRPS. Okay. Great question, Madeline. Mims, I'd love to hear your thoughts on bisphosphonate treatment for CRPS. I participated in the 2017 FDA clinical trial, among others, received significant relief. I go for boosters in Italy to help push back aggressive progression, and I know others who have received remission. It's research, plenty of strong empirical data. Just sad there aren't more aware of it, except Italy. I'm still learning about you and open to your suggestions. I'm just curious about what you think. Yeah, Mims, great question. So bisphosphonates, they have some promise when it comes to CRPS. One of the main things and main reasons it's being used for CRPS is because typically bisphosphonates are used for osteopenia, where we're losing bone. And with CRPS, when we have that heightened pain, and we're not using our limbs, we're not moving, putting weight through our limbs, then we could have, bone loss or muscle atrophy. But I want to be very clear about this. This bone loss, this muscle atrophy, it is not because CRPS is eating away our bones. Okay. So please do not think that that is something CRPS is doing. The reason we're having bone loss, the reason we're having muscle atrophy is because we are not using the painful limb. So, bisphosphonates can be helpful, especially in the beginning of our pain, to help reduce our pain and improve our function when it comes to using our limb again. So, in some of the research, it has been seen that it may reduce bone loss because it's a medication used typically for osteopenia, which causes bone loss. It has shown to reduce pain in some patients, and it might also reduce inflammation in some individuals as well. So that's a great thing. That's good promise for bisphosphonates. So I think in that sense they're worth a try, but only temporarily to get back to function. Because outside of the benefits of what we get from the function from bisphosphonates, there are a lot of side effects that we also have to worry about as well. So for example, you can have gastrointestinal issues, you can experience flu-like symptoms, you can also rarely get osteonecrosis in some of the bones as well. Long-term safety in CRPS has not been well studied, and it looks like these bisphosphonates are most helpful in the early diagnosis area of CRPS. Um, so there might be a temporary relief offered from this, but really the research has only had a few small studies suggesting that they may improve pain and function. And most of that research is using small sample sizes, so a lot more research needs to be done. But it shows a little bit of promise. However, medications are a bridge. They are not a road, meaning we use it to get back to function and then we wean off. That's the important thing. Okay, so great question, Mims. Love it. Love that you're here with us and excited to see what you learn as you go through this. Okay. Tracy, you may have already addressed this question. I've been trying to go through previous Q&As, but I'm considering a spinal cord stimulator due to dystonia in one foot, uh, severe swelling in the ankle and other problems, now lymphedema in my upper thigh, not just the typical pain issue. I'm thin, fairly active, but extremely hesitant to pursue this and want your input on this and overcoming issues. I do have underlying rheumatoid arthritis and previous spinal fusions as well. Yeah, Tracy, great question. And I totally understand your hesitancy. And I would actually say that's good. You should be hesitant. I personally do not think spinal cord stimulators are a good solution for CRPS. I also don't necessarily see them as a good solution for dystonia or swelling. That is not a spinal cord stimulator is not going to resolve those issues. What I would suggest instead is sometimes for dystonia, things like Botox injections, which are temporary and wear off, are good to get the muscles relaxed and get you moving a little bit more. For lymphedema, I would search for a certified lymphedema therapist, as I've mentioned before, to help address that. And then I would look into things that are more non-invasive when it comes to stimulating your spinal cord. So, for example, we can stimulate our spinal cord, believe it or not, by moving around and being active, just like you are. The reason that I'm hesitant about spinal cord stimulators is because the research on spinal cord stimulators is shoddy at best, and the effects often diminish over time. And the majority of studies evaluating CRPS, the use of spinal cord stimulators for CRPS, are small, lack control groups, or are conducted by manufacturers of spinal cord stimulator devices. So it's very much a situation where the evidence for spinal cord stimulators being effective is not really there. If you're watching this and you have a spinal cord stimulator and it's been helpful for you, great. I'm very glad, and it probably will continue to be helpful for you. But I just have to look at this from a broad standpoint. And oftentimes, especially in a lot of studies that I've seen recently, the evidence for spinal cord stimulators having bad effects is pretty large. So, for example, in a big report by the New York Times in 2018, it highlighted over 80,000 adverse events reported to the FDA about spinal cord stimulators from the year 2008 to 2017. These adverse events included nerve damage, burns, paralysis, and worsening pain. And so I want people to be careful and know that because CRPS at its core is a central sensitization problem, using something peripherally, like a spinal cord stimulator, really won't effectively target the central sensitization that we talked about in that presentation and won't facilitate brain reorganization that we are needing when it comes to CRPS. So if you'd like to see my newsletter on spinal cord stimulators, which I sent out a few weeks ago, I'm going to try and link it down in the description below for download for you to check out. But if you're not on my CRPS email newsletter, please do find the link in the description down below to sign up for that so that you can get information not only on spinal cord stimulators, but on ketamine, Scrambler therapy, etc. It's all there for you. So yeah, Tracy, I would encourage you to look for other alternatives. For the dystonia, I would look into Botox injections into the leg. And then I would also look into seeing a certified lymphedema therapist for manual lymphatic drainage or lymphatic taping or other alternatives that they might be able to suggest. I think that'd be good. Great question, though. Kelly, a lot of the CRPS info describes it as pain to the touch or a hypersensitivity to the slightest stimulus, but can it also be CRPS where somebody only has extreme pain with movement of the limb, yet can touch the same limb and that doesn't hurt at all? Excuse me. Yeah, Kelly, no, it can. Yeah, that can be CRPS. Remember, CRPS is diagnosed using the Budapest criteria. You don't have to match all of that criteria to be considered as having CRPS. Okay. So some people do have hypersensitivity to touch, but I would say about 20% of the people that I work with are only having extreme pain with exertion or with movement of the limb, and can touch their limb just fine. But then they also have the color changes and the swelling and the hair loss, etc., that sometimes comes with CRPS. So the presentation of CRPS is usually all over the place. Some people have some symptoms while others don't. Some people have some symptoms some of the time, but not all of the time. Again, we're using the Budapest criteria as our primary source, and you don't have to check all the boxes on that criteria for it to be CRPS, okay? Let's see. Kayla, my toes are turning under and the neuropathy pain is awful. What can I do? Kayla, I'm really sorry to hear about that. Toes turning under, sometimes that's functional dystonia or dystonia. Botox potentially has been promising for that if you haven't tried it. But I'd have to know a little bit more about your background to really like be suggesting that in any way. So talk to your doctors. And then the neuropathy, what I would recommend is you use my video, the Desensitization Explained video, to kind of get an idea on a few things that you can do to start to help with that. Desensitization for neuropathy is usually very effective, and I explained it in a way in that video that is kind of a step-by-step process to get you there. So I hope you can check that out, and I hope you find it helpful. And if you need more help, please feel free to reach out to me anytime. Jessica, it's probably too late to post this one, but I just had a chance to watch episode 5 on YouTube. I'm concerned now because I've seen at least a dozen therapists and psychiatrists in the last 10 years. Unfortunately, I have been on daily benzodiazepines since 2009. I've tried appealing to hospitals and psychiatrists to help me wean off of them, but it has always been against their medical advice. Coincidentally, the only thing that helps at all to alleviate my CRPS pain are the benzodiazepines. I am so used to taking a pill when uncomfortable emotion surfaces that I have no idea how to navigate, confront trauma, or more recently, pain without them. Do you have any advice or experience with this? Yeah, Jessica, I mean, I totally get it. When we have uncomfortable emotions, it is easier a lot of times for us to take a pill or eat a sweet treat, like ice cream or do excessive exercise, like I sometimes do, or turn to something like alcohol or a substance of sorts. Now you've started on benzodiazepines in 2009 under medical advice, so that is something that we sometimes have to do. But if your objective is to eventually wean off of them, then working with or finding a doctor who is in line with that plan for you would be a good thing. When it comes to confronting uncomfortable emotions, that takes practice. It takes a lot of practice. And if you've been dealing with this for, over 10 years, then it's going to take a significant amount of practice to learn to navigate and confront trauma in those certain ways. So if you remember in the presentation earlier in this video, number 6 was personal factors, and that includes trauma and emotion. So if we're going to navigate through and feel that emotion rather than feel it as physical pain, one of the things we have to do is work with someone who's good at doing that. Okay, so that can be a psychologist, or that can be someone in the form of a pain coach like myself to teach you how to do it. In module 7 of my online program, that is something I dive into. That module, the title of that module is Trauma and Emotion. Okay. And it talks about all the emotions around CRPS and how to properly navigate and confront that trauma and those emotions. So if you'd like help with that, I would be more than happy to help you with that. And we'll go from there. Okay. So I know it's scary. I know that you might feel concerned. But this is possible, okay? Even after we've been to a dozen different therapists and things like that, sometimes you just need someone who knows something specific that can work for you. Might be me, might be someone else, but please don't give up, okay? Donna, actually, Pamela, after an infusion in my lower Oh, an infusion to lower my pain from CRPS around a 5 or 6. Why do other pain from injuries seem to hurt? Example, knee, shoulder, and arthritis. Yeah, Pamela. What happens sometimes with CRPS, we have that central sensitization where everything is heightened up. And then when we have an infusion or something to start to lower that pain, things start to reduce down, at least the noise that is being created from CRPS. And that noise, once it's reduced, allows us to start to notice other things that are hurting. So I think that your pain from your other injuries in your knee, shoulder, and arthritis has always been there. But once your CRPS pain starts to come down, that pain is just more noticeable for you. And that is because that central sensitization is coming down, and then we have these other ailments we need to pay attention to. The best thing we can do for pain, the best medicine for pain, is function, movement, exercise. Okay. So, maybe we start to brainstorm on what we can start to do when our CRPS pain comes down to get back to functioning and moving around. Let's use these infusions and the period after the infusion where our pain is down to start to exercise and make our body more resilient. And when we do that, the knee, shoulder, and arthritis pain, that will all come down as well because we'll be reducing inflammation, getting our body just generally more healthy, and feeling good about ourselves and the resilience that we have. So it's no fun that these other injuries seem to stand out after we reduce our CRPS pain, but at least with a little bit lower CRPS pain, we can move back towards some function and some things that we love and enjoy doing. Jessica, hey Chase, my medical team has expanded. A nurse case manager called and explained to me that they're essentially guessing with my case at this point. They called me their unicorn case because part of the state of Massachusetts where I live has never seen a case like mine before. I'm being asked to go to a hospital a couple hours away so that they can essentially research me there, and I'm having a hard time with this decision. Why don't medical personnel from different states with different experiences just share their knowledge? Is this a common situation for a patient to be so singled out? A vascular surgeon who heard about my case after being consulted by my ER team is now also eager to meet me, but I've already seen a vascular surgeon and was dismissed by that care group. I want to get help and maybe be the guinea pig my area needs. However, I'm nervous about this becoming too much of my identity. Advice. Yeah, Jessica, that's a valid nervousness to have. My advice would be to potentially slim down your care team. Okay. If you've received the diagnosis of CRPS and you don't have a bunch of other uh, chronic or scary diagnoses, then what I always encourage is that we slim down our team to something like a physical therapist, a psychologist, and maybe a neurologist to help rule out anything else. The reason I say that is because when we have too many cooks in the kitchen, that makes for a bad meal. Okay. When we are getting too many opinions thrown at us, especially when we're already in a state of hypersensitivity and fear, if we get people who are just guessing and saying things that might sound scary to us, that will harm us in our long-term outcomes. Okay. So, for example, when I worked at Texas Children's Hospital, I was on an FND team, which include functional neurological symptom disorder, which included a psychiatrist, myself, and a neurologist. When parents would come in, they would have had a whole bunch of tests done on their kids. They would have seen a rheumatologist, they would have seen a vascular surgeon, they would have seen a cardiologist. And in pretty much all of those cases, everything came back normal. So at that point, there was no reason for them to be going to a bunch of other medical providers and getting a bunch more tests done, especially not for a little kid who's going to feel scared and feel like something is significantly wrong with them by being around all these providers. If you have a team of providers who are essentially guessing with your case, they are not the team of providers that you want to see. Okay. Find some providers that have some experience with this and keep your team small. Okay, so like I said, neurologists, psychologists, physical therapist is usually the type of team that I think is great, and then of course your PCP. Um, and yeah, I would be careful about allowing this to become too much of your identity. You know, you can get wrapped up in the idea of I'm this mysterious guinea pig, or you can start to do what you can to move back towards function and slim your team down in such a way that gives you solid advice to move forward. So yeah, my general synopsis about this is if your team has admitted to you that they are guessing and you're a unicorn to them, they are not the team that you need to be working with. I'm sure they're great people, but that is a red flag to me. Okay. Heather, best way to explain CRPS to a boss. Truthfully, I'm wanting to learn more on how to better explain it. I was asked exactly what it is, treatment, remission, getting better, etc., because of needing to take days off due to higher pain than can be tolerated, doctor's appointments, and such. Yeah, Heather, great question. If you want to explain to your boss or to a loved one, etc., I would recommend watching my CRPS explained or explaining CRPS to a spouse video. I recently put that out, and I feel like that's a good overall thing to learn, like kind of how to explain it to the lay person. Um, as far as speaking about it to your boss, what I would essentially do is maybe talk about some of the talking points from my central sensitization presentation at the beginning of this video, and just essentially explain to him that it's a condition where your nervous system has become overloaded. You are processing pain in a way that doesn't make sense. And we need to retrain the nervous system by reducing our stress, taking the proper medications, and going to doctor's appointments such as physical therapy treatments, etc., to begin moving towards function again. I wouldn't give him a hard time frame on recovery because that can get tricky when it comes to working with employers. But I would say it's going to take time. And Jenny commented and said some things about how your boss can legally not ask you this and you should talk to HR and HR should be handling all of this. I partially agree. I think that, talking to HR is definitely something you could do, and working with HR and your boss in tandem is important. But I wouldn't immediately take the stance to your boss that like you shouldn't ask me about this. I already talked to HR, because that can create a stressful and distressing environment for work. I would kind of try to find a happy medium, because between giving your boss a little information, especially if your boss is understanding, and giving HR all the information that you can to help advocate for you. But if your boss is someone who is hounding you or giving you a hard time, then I would leave it to HR. But I would try to get everyone in the same loop so that they can help you in the best way possible, rather than taking a defensive stance right away. Heather, is it possibly possible to initially have CRPS in the entire left arm at the same time as the right leg and foot, but spreading as well to the left foot, with it initially usually being one region limb. Some doctors are saying yes, others are saying not possible. However, all other symptoms point to CRPS. Yeah, Heather. So over time, as our brain is trying to process what's happening in our limb, especially when we're centrally sensitized, our brain's map of what is going on in the body is becoming smudged. Okay, the map is becoming less clear. And the brain's map is called the motor sensor or sensory motor cortex. I'll put it on screen now. And that map basically has halves of the body side by side in the brain. Okay. And if you look at the map, the left foot and the right foot are right next to each other. The left arm and the right arm are right next to each other. And so as the brain gets more and more confused because of how much pain we've been in, or the amount that we're not functioning or giving the brain any information, that map can become blurry or smudged and kind of spread over in the brain to the other limb. And so that's why you might feel that mirroring or that pain in the other side. It is not because there's some sort of poison in your right arm that's going up and across your chest and into your left arm. No, it is simply a processing problem in the brain, not a poison or an infection in the arm. And I know that might be hard to understand, but I go into much more depth in my desensitization explained video. So if you're confused on that, please do check out that video. And that not only explains why it's happening, but it also explains how to start to reduce that pain problem that you're having. What you'll notice as things start to get better, the symptoms will start to localize and oftentimes go back to the limb that it started in. So if it started in your left arm, then the more that we start to move towards function and desensitize our body, eventually you'll notice all the symptoms localize back to the left arm, and eventually the pain can go away. Okay, so yes, it's possible. Um, yes, it's scary, but it's not something that's permanent or forever. And if we give the brain information and work on this rehabilitation, things can get better. Okay. Jacinta, hello. In your recent newsletter, you briefly mentioned Scrambler therapy and neuromodulation. But my question is, what success rate have you seen with Scrambler therapy and what good research is there to back it up? Also, could it exacerbate pain if the practitioner doesn't have advanced training? Do you think Scrambler therapy downregulates the nervous system differently to breath work, for example, or does it have a direct and different brain modulation effect? Some evidence-based in-depth info would be great. Thank you. Hey, Jacinta. So I'll give you a general overview, and then if you want some more in-depth info, I have a Scrambler therapy newsletter that is more in-depth that I think went out since you last posted this video. So if you're not on my email list, please get on my email list, and that newsletter is there. Otherwise, I'm going to put a link to that newsletter down in the description below also. Okay, that will have some research links there for you that you can check out. Um, if the practitioner doesn't know what they're doing, it could potentially exacerbate the pain. And so, what I would recommend is you reach out to Max Wesenberg. He is in Wisconsin, and he's probably one of the providers that I trust the most, simply because we've dialogued with each other the most. He was trained over in Italy, so he's got some good background there. And I think he's a good person to ask questions to. He has a free or really cheap consultation you can have with him, and you can ask him all of these questions. And he can talk about his success that he's had. I've seen him have some great success. Some of my clients have had good success with him, gotten a reduction in pain, and then finished out their treatments with me, or have gone to me, met Max along the way, had a big reduction in pain, and then finished out from there. So Max even had clients who got completely out of pain, which is amazing. So I would reach out to Max. I'll put a link to his website down in the description down below, and then that would be the best place for you to get more information on Scrambler therapy along with my newsletter. But great question. Thank you so much. If there are treatments I recommend that I think are good, I think Scrambler therapy can be helpful. I think ketamine can be helpful. I think both are non-invasive, and I've seen some good success with people dealing with CRPS from those. Okay. Donna, hey Chase, POTS has really been kicking up lately with the spring thunderstorms. Any recommendations? Good news is I've been eating more lately. Awesome. And we'll be starting the online yoga program tomorrow that you sent to me. Thank you so much for all you do. You're a blessing to so many lives. Well, thank you so much, Donna. That's really nice. And then Tammy said here, I'd like to know more about this yoga program, please, Chase. Donna, POTS is a positional problem. So, you getting up from lying down to seated or going from seated to standing, you might have some dizziness, you might have lightheadedness, some vision issues. So, the thing that's going to help that is exposing yourself to new and different positions. And what better way to do that than through yoga? Okay, so in your question, you actually answered it yourself. The yoga program that I sent you, which is an app, it's called Down Dog. That app is either free, I think there's a free version still, or at most it's like $50 a year, which is super cheap. That app is really great because it has a whole bunch of different versions of yoga, yin yoga, restorative yoga, vinyasana yoga, these types of yogas that are various levels of challenge. And you can also customize your plan or your yoga session to be as short as 10 minutes, as long as 90 minutes. And you can even emphasize certain areas of the body, like the hips or the low back or the shoulder, depending on what area is tight that day. So, Down Dog, that yoga app, would actually be the perfect way to help with your POTS. Just do it in a slow and paced approach. Okay. So that's my suggestion when it comes to the POTS. And let me know how it goes. You've probably, this is a few weeks ago, so I'm sure you've started using the app. So I'd love an update. Let me know how it goes. And I'll be seeing you here in a week or so for our first pain coaching session. So I'm really excited to start working with you, Donna, one on one. Tracy, my CRPS foot feels like it's in a concrete boot, pressure all the time, also feels like it's numb. The sensitivity has gotten so much better over the years. This feeling is awful. I can't wear shoes without a back as they just slip off. Tracy, I'm super sorry to hear what you're going through. But as I said here, I'm not sure what you're asking me from a question standpoint. So if you see this and you could comment down below what your question is, I would love to help you. If you're looking for help on this feeling that it feels like it's in a concrete boot, I'm gonna need to know a little bit more about your story. So why don't you reach out to me one on one for a consult, and you can do that again on my website, thewindowpain.com, PAIN, or down in the description below, you can find a link there for me. Okay. All right. Alice, when I first got diagnosed with CRPS, I kept hearing people say that aggressive treatment within 6 months of diagnosis is necessary for remission. When I asked what aggressive treatment meant, they would say medication like gabapentin and lumbar nerve blocks. I haven't tried any of these traditional treatments because the thought of those meds scared me, and nerve blocks seem really invasive. Thankfully, my pain isn't so severe, so I've managed with okay without either. Is remission possible even without having tried these more traditional treatments? Are the traditional meds and nerve blocks somehow necessary for preventing CRPS and from getting worse or spreading? So yeah, I commented here, but I'll say outright, by no means do you need medication or nerve blocks to get better. You also don't need to fear, CRPS never getting better because you didn't get aggressive treatment right away or got diagnosed late. It took a while for me to get diagnosed, more than 6 months, and I have no pain today. I never did any nerve blocks or ablations. I did take a whole bunch of medications, but those really just made things worse for me. And I have newsletters about why that is. And so, a lot of times, and this is the problem that I mentioned earlier with Holly's question about support groups, a lot of times the things that we are told in support groups create a lot of fear for us. And the more fear that we have, sometimes the more painful things can be for us just from the sheer worry of things. Okay. So I want you to know that you can get better from CRPS, have remission or recovery, no matter how long it's been. This happens all the time with my clients, and you'll see that in my testimony videos. And by no means do you need to take certain specific medications or get nerve blocks. In fact, a lot of times nerve blocks or medications can lead to making things worse. Can you try some of these things? Sure. But I think the best thing to try first would be something non-invasive, such as my online program, Scrambler therapy, something like ketamine, those kinds of things I think would be a better route than feeling like you need to pump yourself full of medications or get nerve blocks. Okay. So great question. I'm sorry that a lot of those comments probably scared you. Please take things slow. I actually, you're in my online course now and on the waiting list for coaching. So I think already since when you had this comment, things have improved. So yeah, good question overall. Renee, I posted this a while back in Q&A 4, I believe, but I didn't see where it was answered. If it was, I apologize. Can you point me in the right direction? No problem at all. I don't think I answered it. I think I forgot about it, or missed it, but it's a great question. So my physical therapist, who is from Utah, told me the clinic where he used to work in Utah was directly across the street from a pain management clinic that did sympathetic nerve blocks. He said they did the procedure, and as soon as the patients were awake, they sent them straight to PT across the street. He also said they had a new CRPS patient nearly every day of the week. Has anyone done any studies to see if this is demographic? Do people in certain areas get it more than people in other areas? And is there a common denominator? I'm just curious after hearing that from the physical therapist. Why would so many people in the same area get CRPS? Yeah, isn't that interesting, Renee? Um, I'll tell you why. Because knowledge of the condition could perpetuate or create the condition. I know that sounds wild, but let's put this to the test, okay? When it came to my back pain, for example, my whole life, probably from maybe when I was 10 years old on, I was told that my dad or my dad's family has a bad back. We have bad backs, just genetically, our backs are bad. And inevitably, eventually, after being told that enough times, I developed back pain. Now, is that because I had a bad back or because I was programmed to feel like my back was bad? That's a question to think about. So let's take another example, okay? Whiplash. Okay, so whiplash is heavily advertised in the US and in the UK, and so we see a lot of incidents of whiplash following motor vehicle accidents. However, and I'm not sure of the exact country, so forgive me if I get it wrong, but in the UK and the Netherlands, there are the same amount or close to the same amount of motor vehicle injuries or accidents, sorry, per year. However, in the Netherlands, there are virtually no incidences of whiplash or neck pain following these collisions. But in the UK, there's a ton. And you have to sit back and ask yourself eventually, is that because more people in the UK are getting hurt, or is it because whiplash is advertised in the UK, whereas it's not so much in the Netherlands? And so this is what I mean when I talk about the nocebo effect. The understanding of something that could be painful or an adverse effect, and then that happening to be the thing that happens. Okay. So the belief that something will be harmful makes it more likely that that thing will be harmful. So this area in which more people are getting CRPS than in others, I believe is a direct result of the knowledge of CRPS in that area and the worry about it happening and how that affects the overall sensitization of the nervous system. This is why, in my belief, you see, moms and daughters or kids within the same school. Oftentimes someone will have CRPS in a school, and then there'll be another person in the school that develops CRPS, or another person, um, or people within the same family. It can't be genetic in the case of a classmate developing CRPS, but it can be from the belief that CRPS is something that is possible and the worry around CRPS in general. And so I do not see this as a geographical area problem. I see this as a knowledge of CRPS and a fear and worry problem. Okay. I hope that makes sense. And I find it very interesting, but not surprising. Kelly, for someone's trying to decide between a stellate ganglion block or trying scrambler therapy as their next treatment step, which one would you recommend trying first and why? Kelly, I would fully recommend scrambler therapy first. And the reason why is because it's non-invasive. A lot of times, nerve blocks will temporarily relieve the issue, but then eventually the nerve is going to start to regenerate, and oftentimes the pain comes back worse than before. Additionally, I would also have you consider my online program because my online program is less money than even a single treatment of Scrambler therapy. Okay. And the reason why I recommend that is because it doesn't require travel. There's a lot of knowledge there for you to absorb. And I think it would really benefit you in the long run to make a more informed decision on if you need to take another one of these treatment routes. But if I had to pick between the two, I would say scrambler therapy would be a good step. And I have to ask with the amount that scrambler therapy costs, which I think is $300 to $400 for a single treatment, but you need to do it over 2 weeks. Why not give the online program a try? That is just around $300. And I think there would be a lot of information in there to help you start to take control of this yourself. Jordan, is remission truly possible? So much of the talk online about CRPS seemed like people saying it's a lifelong and a majority of people suffer forever. I think it would be awesome to hear someone provide hope for once instead of just doom and gloom. Yeah, Jordan, remission is 100% possible. Not only do I myself not have any pain, but don't fear the pain coming back at all either. Um, Myself and my clients are testimony of this, but in fact, 85% of people after diagnosis go on to live completely normal lives after getting diagnosed with CRPS. The doom and gloom and the fear inducing information about CRPS is part of the problem, in my opinion. And a lot of times in these other support groups, that is all you see is doom and gloom. But I promise you, people do get better. People go on to live completely normal lives, and you will see that time and time again the more you look for it. In fact, the world record holder for the plank was diagnosed once with CRPS. Okay, so just know that people do get better. Remission is 100% possible, and I see it every day with the people that I work with all over the world, and in my own experience in my life, having been diagnosed at one point. Jacinta, remission and full recovery is totally possible. In fact, majority of people recover with patience, self-management of the nervous system, and movement despite pain within reason are vital. Fantastic, Jacinta. 100% agree. This is exactly right. Tracy, how do you know if it's spreading? It first started in my left arm and left leg, swollen nerve pain, muscles would act up. Then the top of my right leg feels like buzzing bees and right fingers started dancing. Great question, Tracy. What I would do is I would refer to the video that I shared there, my CRPS Zoom number 4, episode number 4 on stages, spreading, and remission. It'll help clear up a lot of the worry and misconception about CRPS as a whole. So I said I would answer this, but honestly, just watching that Zoom is the best thing you can do. Zoom number 4, and I'll put a picture of it here. You can find it on my YouTube channel. Cecilia, so I understand that the pain is linked to emotions that are pushed in versus let out and worked through. Since I understood that, I am very careful about my emotions and try to address them and address the situations that trigger them. This creates unexpected situations. My surrounding is surprised and sometimes has a hard time welcoming my emotions and tries to reason with me. Now, when I get triggered by a situation, I don't push the emotion down, but it comes out a bit abruptly, and people are very surprised. I don't want to go back to how I was before, but do you have any tips slash books to read about learning how to better express emotions? Yeah, that's a common thing. When I work with my clients about letting out these emotions, in particular anger or frustration or grief, it can feel really scary, especially if you're not used to it, especially if you don't know how to process emotions in general. What I would suggest is considering what the origin of these emotions could be. So if you find yourself feeling angry or having angry outbursts often when you start to let yourself feel emotions more rather than let them turn into pain, what I would consider is writing down all the things in life that you may be angry about. For a lot of people, it is things that happen in childhood. It is the situation at their job. It is the relationship with their spouse. You make a long list of the things that you're angry about, And then you start to go through that list and think, okay, how can I change this dynamic, whether it's in my relationship, at work, or in my relationship to the past, to have less anger associated with it? Some things that my clients do in order to have less anger around these things is they'll write letters to the people that have hurt them. So, for example, if your father was a very abusive person, you write letters to your father addressing the anger you have towards him. Or if your mother wasn't there for you in the way that you wish she should have been, you write letters to her to let out the anger towards her. You don't give these letters to those people, but in writing these letters, you get to see on paper, wow, this is actually what I'm angry about. Because a lot of times when these emotional outbursts happen that create an unexpected, tense situation in your environment, it's not because of what's happening in that moment. It's because of things that happened in the past that have you amped up or you're being reminded of. Okay, so letting out these emotions and properly expressing them can be done through writing letters, going to a rage room. I've had clients tape a picture of their ex-husband on a watermelon and smash it on the ground. Those are all ways to express anger, which in my belief about what's happening with CRPS, those personal factors that I mentioned in my presentation is anger that has been pushed down so much it got stuck in your foot. Okay. And I know that sounds silly, but I believe that is a big part of this situation that we find ourselves in when it comes to CRPS pain. And to kind of dive into that a little bit more, one of the things I often do with my clients is kind of a thought experiment. Okay. And that thought experiment basically is um, what element is normally associated with CRPS? And that element is usually fire. Okay. And what color do we see most often when we think of CRPS? And that color is usually red, when we see the red shiny limb. Okay. So red and fire. What color does your face turn when you're angry? Red. Okay. And when you think of the emotion anger, when an artist, was conceptualizing the emotion anger for the movie Inside Out, it looked like this: red and fire. And so in certain ways, it's right in front of us. All of the imagery around CRPS is fire. All of the colors used to associate CRPS is orange or red. And I believe anger is a big reason that we end up with this heightened, amplified, centrally sensitized nervous system. And processing and letting go of that anger is a big way in which we start to reduce the pain associated with that amplification of our nervous system. So this problem is more than just a problem with our limb. I believe it's a complex mind-body experience that we need to address from all angles, including the emotional expression angle. So, great question. Holly, when working with PT and neuroplasticity, how long should the increased bone pain and burning last? Or could I be not doing something right? Am I missing something or are some slower in healing? So when you first start to do new things, sometimes you will notice increased pain or increased burning. This will likely be an up and down process. Remember, recovery is not a straight line. Recovery is a up and down loop-de-loop experience. And so I know it's easier said than done, but trust the process one day at a time. And if you feel like you're putting yourself into big flares, maybe scale back just a little bit to help make the pain more tolerable. But yeah, some people have a slower road than others. And remember, this is not just all a functional thing when we're doing PT, and neuroplasticity is a mind-body process. So if you need a little bit more guidance, reach out to me anytime, Holly, and we can talk about more specifics. But yes, our body is going to have weird symptoms as we start to move towards more function. We might notice some increased pain or burning temporarily. And Holly, once more time, have you heard or read the Diet by Blood Types books? And connecting that to the question, what foods other than eggs, butter, and I can't remember the third, that usually are seen with the prior two? Fine-tuning my brain, food, exercise, and knowledge. Yeah, Holly. So these blood type books largely don't have research really backing them up. Based on what I've kind of looked at them as a brief overview, they're kind of a scam, and so I would encourage you not to get too wrapped up in that. Just focus on having a balanced diet that makes you feel good and healthy, regularly exercising and reducing your stress. I want to get too specific on, eating for your blood type or anything like that. Humans have been around for hundreds of thousands of years, long before we knew what blood types were, and eating just a healthy diet in general has always been the gold standard. All right. Well, that looks like most of what I can do for this Q&A. And I think that I will take some of the other questions that we have and put them into Q&A number 9 or 10. Thank you guys so much for coming by today and watching this Q&A, and I hope it was as helpful as you were hoping it to be. There are many more to come, and reach out anytime for further help or assistance. If you really enjoyed this video, please leave it a like, as it does take a lot of time to put together. And if you're not subscribed yet, please do subscribe so you can get notified of my next video coming out in just a few weeks. Thanks so much, guys, and I will see you in the next one. Take care.